You're listening to Body by Poly. I'm Dr. Elaine Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. I want to talk a little bit about some very important topics when it comes to breast implant surgery, and those are the topics of breast implant illness, BII, also known as breast implant-associated illness. But I also want to delve a little bit into a couple of other topics: breast implant-associated large cell lymphoma and breast implant-associated squamous cell carcinoma. So let's start off with breast implant illness. That's something that I see quite a bit of because I have patients coming in complaining of very vague but very real symptoms such as fatigue, mental fog, depression, rashes, joint pain, all of these things that cannot be attributed to another diagnosis. So these are patients who've had breast implants for many years, but then they develop these vague symptoms that cannot be attributed to anything else. And they go through a whole slew of studies and exams, and nothing comes up other than the fact that they've had breast implants for many years. And when I see these patients, I have a very long, detailed conversation with them, and I explain to them that in my experience, I see a lot of patients with these symptoms, and sometimes removing their implants can alleviate those symptoms. Sometimes it doesn't. But there's no denying the fact that removing implants can alleviate these symptoms because the implants themselves are foreign bodies. They do activate the immune system. So there's definitely a relationship between breast implants and some of these symptoms, but it can be very vague. And like I tell patients, it's not guaranteed that removing the implants will alleviate all of those symptoms. However, there are other real entities such as breast implant-associated large cell lymphoma, which is a well-proven entity. It's still very rare. It could be in about 1 in maybe 30,000 augmentations. I've never personally seen one. I've been in practice for over 25 years, but it is definitely described, and that's something that can be associated mostly with textured breast implants. And usually after a few years, up to 10 years post-op, patients sometimes may develop swelling or fluid or redness around an old implant. And then sampling that fluid, we sometimes find lymphoma cells within that fluid. And it's very important to remove the implants, remove all of the fluid, remove the capsule, because if allowed to progress, then it can lead to widespread lymphoma. Again, extremely rare, but definitely described. Even more rare is breast implant-associated squamous cell carcinoma. That I've also never seen a case, but I think there have been a few hundred cases described globally. But that's a squamous cell carcinoma, which is a pretty aggressive cancer within the capsule. So not exactly related to the breast tissue or the implant itself, but the capsule that's surrounding the implant. So extremely rare, highly unlikely that you will ever see one of these cases, but it can happen, and it's definitely something to be aware of when considering breast implant surgery. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.